Hi, this presentation is on pharmacology of drugs use in nasal congestion. Nasal congestion is a symptom which is associated with many diseases like rhinitis and upper respiratory infections. Nasal congestion or stuffy nose usually occurs when nasal and adjacent tissues and blood vessel in these tissues they become dilated or swollen, means there is a vasodilation in those tissues which leads to excessive fluid collection in those tissues which causes stuffy plugged feeling in the nose. Nasal congestion may or may not be associated with the running nose or nasal discharge. Blockade of nasal breathing occurs in nasal congestion patients. Nasal congestion may interfere or can interfere with hearing and speech also. Significant nasal congestion may interfere with sleep. It may cause snoring and can be associated with sleep apnea or upper airway resistance syndrome. Causes of nasal congestion: anything that irritates or inflames the nasal tissues will produce nasal congestion. Various factors which may produce nasal congestion are smoking, infection, cold, flu, sinusitis, and allergy. So, smoking, infection, cold, flu, sinusitis, and allergies they may cause nasal congestion. Coming to drugs used for nasal congestion, mainly the sympathomimetic drugs, which are having alpha 1 agonist property, they are extensively used for nasal congestion because the sympathomimetics through alpha 1 receptor stimulation they produces vasoconstriction, because nasal congestion there is a vasodilation, and these drugs, sympathomimetic drugs, they produce vasoconstriction, thereby providing relief in nasal congestion. So these sympathomimetics through alpha 1 agonist property they provide relief in nasal congestion, and they are extensively used for nasal congestion in patients with rhinitis and upper respiratory tract infection. So, as discussed earlier, alpha 1 receptor stimulation by sympathomimetic drug causes vasoconstriction in nasal tissue, thereby providing relief in nasal congestion. These drugs decrease resistance to airflow by decreasing volume of nasal mucosa through alpha 1 receptor stimulation. These sympathomimetic drugs they are available as both oral as well as local nasal application formulation like nasal sprays, nasal drops, etc. Now coming to the formulations with sympathomimetics which are used for nasal congestion. So drugs for nasal congestion in various formulations. So first category is local nasal application formulations of sympathomimetics. Various examples are phenylhexedrine, which is used as nasal inhaler; nefazoline hydrochloride, which is used as nasal spray or nasal drops, which is available in 0.05% concentration as nasal spray or drops. Next drug is tetrahydrozoline hydrochloride, which is available as nasal solution in 0.05 to 1% concentration. Next drug is oxymetazoline hydrochloride, which is available as nasal spray or nasal drops in 0.025 to 0.05 concentration. Next drug is xylometazoline hydrochloride, which is available as nasal spray or nasal drops in 0.05 to 0.1% concentration. So you might have seen in the market various formulation which are available for treatment of nasal congestion. They contain one of these drugs in their formulation, like Otrivin and Vicks, nasal sprays and nasal inhalers. They contain one of these drugs, which are sympathomimetics, which are vasoconstrictor. And by vasoconstriction through action through adrenergic alpha 1 receptor, they provide relief in nasal congestion. But if somebody is using these local drugs extensively or very heavily, then that excessive use may cause structural damage to mucosa in nasal tissues, which may lead to loss of efficacy and rebound of symptoms. You might have seen after chronic use, some patients they do not respond to these drugs because the excessive use has caused damage to mucosa or mucosal tissue in the nasal mucosa, and which leads to loss of efficacy and rebound of symptoms. So after some time, after chronic use, patient stops responding to these formulations. Second category of formulation for nasal congestion are oral sympathomimetics. These drugs are used orally. Various examples of sympathomimetics which are used orally for nasal congestion are phenylephrine, ephedrine, pseudoephedrine, phenylpropanolamine. So one of these drugs you will find in oral formulation in combination with some other drugs. So these are all sympathomimetics. Out of these four, phenylpropanolamine is less CNS stimulant. Other drugs like ephedrine, phenylephrine, they are slightly CNS stimulant. So phenylpropanolamine is very commonly used in oral formulations for treatment of nasal congestion. That's all in this presentation. Thank you very much.